Welcome all to this video. A little introduction about me. My name is Varshini and I have written my final year MBBS examination and my results are out and I'm yet to start my internship. So also I have this account called as Medicine of Grace on Instagram where I share what I study, the resources that I use and note taking, every small tips here and that. So you can check out, I'll just add the link down and you can just check out my Instagram page. Now I'll tell you what this video is about. This video is going to be about final year MBBS practical exam and how I faced it. What are the things that you have to definitely know in each system so that you can, beyond passing, you can even score better marks. And the Viva questions that were asked to me, what are the long cases, what are the short cases, some easy, tricks and basic minimums that you have to know in each cases before you enter the examination hall. What are the instruments, drugs, everything. I'll give you a short introduction. And my advice would be to read every cases, every system. Like you have to have a prototype case for every system and you have to read it, because omitting a case, maybe you can do that for models or internals exam or in posting that you have, but when you are facing a university practical examination and when your cases are unpredictable, if you are going to get a case that you didn't prepare for, you are the one who is going to panic at the end of the day, and we don't want that, especially for university practical. So what I'm going to do is I'm going to give a proper introduction about each system and what are the general things that you have to write in a medicine case pro forma, so that beyond passing you'll be able to get even good marks. So this is how this video is going to be. Okay, now I'll tell you why I'm doing this video. This is because in theory, if you are reading certain resources, reading textbooks, taking some notes and writing something relevant to the question, the examiners would be happy and they will even give you good marks, okay, and you'll be able to pass and get good marks. Whereas in practical examination there are going to be internals watching you. Some externals, they might want you to do the examination. So one thing is you have to be confident in your case. Next thing, you have to have knowledge about the case. So that is what the examiners expect. They don't want you to answer well like a PG student or anything. They just want you to know the basic minimum, and the extra tricky questions are when they want you to score even better marks than you've already scored. The examiners don't, their aim is to not fail you or anything. They want to just push you out of the whatever year you are in. So best thing that you have to know is know the minimum basics and some extra things so that you can do well in the practical examination. Okay, so generally what you have to know is that how to write a basic case sheet. I will add all the four main system case sheet below, so that you can check out. I'll just upload it in the Google Drive and you can download it and you can refer it. So just watch this video entirely so that you can get basic idea about each cases. So first I'll start with the general things that you have to know how to write general case sheet, then I'll go system wise so that it will be easy for you to go along with me in this video. First thing is writing the preliminary data. Okay, so you have to properly take like name, age, sex, everything. You have to refer the case performer and write. My advice here would be audible to the examiner. There are going to be an n number of students presenting on that particular day. If you want to stand out, if you want to be unique, you have to be audible, better audible than everyone. And another thing is, don't irritate the examiner by shouting too much, but you have to be audible to the examiner. So first thing is that. Second thing is narrate it as a story. Tell it as a story so that examiner would be interested. Like he should be asking like what next. He should have that idea in his mind. So don't just see the case sheet, and maybe I think in some university you just have to give the case sheet, and without the case sheet you have to be able to narrate the story. Before attending the Viva, you just go through your case sheet, have ideas about the patient details, because you are the one who wrote the case. So you definitely have to know, even if you are submitting the paper and they're asking you to present the case without the case sheet, you should be able to do it. Now I'll tell you about vitals. Every 4 parameters of the vitals are very important, not only for medicine but also surgery and other subjects, because these 4 things are going to be very essential. And if the examiners are asking question in this and you're answering very good, it'll make a good impression on you, because I told you, right, there are some basic things that you definitely have to know. Among that, vitals are very important. So there are 4 parameters in vitals. The first thing is pulse rate, then you have respiratory rate, then you have blood pressure, then you have temperature. Coming to the pulse rate, you have to know everything about pulse. Okay, so you have to know what is normal rate, rhythm, volume and character. These are very important, and you have to write whether there is any radial delay or radiofemoral delay. Coming to the rate, you have to know what is tachycardia, what is bradycardia. Rhythm, you have to know whether it's a regular rhythm or it's a regularly irregular rhythm or irregularly irregular rhythm. Okay, so there are conditions like atrial fibrillation where you'll get irregularly irregular rhythm. So you have to know what are the conditions you'll get this rhythm, or you have to know where you get regularly irregular rhythm. Okay, pulses, parves, et tardis, you have to know what is this and what are the conditions they are seen. For example, pulses, paradoxus is seen in constrictive pericarditis. Okay, you have to know different conditions. Like one example is enough. We don't need to answer 5 conditions for everything. If you have readily available 2 examples, that is more than enough. Okay, then you have to know what is pulse deficit also. Then you have to know where are the arteries where you can palpate the pulses. There is radial pulse, there is femoral pulse, there is brachial pulse, right? So you have to know all this. Coming to the radial delay and radiofemoral delay, this is again very important. If there is any radiofemoral delay, that is, it's a sign of coarctation of aorta. So the examiners expect you to know all this. You might actually end up getting one question from the pulse part alone. Okay, then you have the respiratory rate again. So respiratory rate, in men they have this abdominothoracic type of breathing, and in females they have a thoraco-abdominal type of breathing. You have to know that. And you, for example, in a COPD patient or a chronic TB patient, there will be usage of accessory muscles of respiration. Now the next question would be, what are the accessory muscles of respiration? You have to know the S muscles, right? Scalenus anterior, sternocleidomastoid, and there are other muscles too. So you have to know what are the accessory muscles of respiration types. Any difficulty in breathing or anything, you can write in the respiratory rate. That is tachypnea or dyspnea. Okay, now coming to the blood pressure. But blood pressure is again important. You have to know what is systolic blood pressure, what is diastolic blood pressure. You have to know the definition. Again, you have to write the pulse was measured in all 4 limbs. Okay, you have to write what are the position in which it was measured. Then they might ask you what is white coat hypertension, what is pseudo hypertension. There are things like that, basic things. Again, you have to know regarding the blood pressure. Another point that you can know about blood pressure is what is pulse pressure and mean arterial pressure. Now coming to the temperature. Temperature, you have to know what is the normal body temperature. Then you have to know what is hypothermia, what is hyperthermia. And if the patient ends up having a fever, they might ask you what are the types of fever. There is continuous fever, intermittent fever, relapsing fever, remittent fever. So you have to know the definitions for each of this. There is definitions, and there are some named fever, like in malaria we see tertian fever. So you have to know what are the conditions where we see different types of fever in, like Pearl-Epstein fever we see in Hodgkin's lymphoma. So these are the basic things that you definitely have to know in the vitals. And apart from this 4 things, you can also in a medicine case, especially if the patient is having a right heart failure, you can mention about JBP, whether there is any elevated JBP or not. But like refer to your university. If they expect you to write about JBP in the vitals, please write it. Otherwise, if there is like they are asking you not to write it, please avoid. Okay, they are writing about JBP. We can write directly about it in the systemic examination. Now coming to the next part is that Piccle. Okay, everyone from the first year physiology, we know about Piccle, right? So what are the components of the Piccle? Paler, icterus, cyanosis, clubbing, lymphadenopathy and edema. For all this, please go through the definitions. That is very, very important, because everyone will know that paler is seen in anemia, icterus is seen in jaundice, especially when the examiners are cool and they just wants to pass you on anything. They are going to ask you the definitions. They are going to check whether you know the basics. So please know the definitions for everything. It is in any clinical book you can find the definition. Now I'm going to tell you a little points about everything. So paler, what are the sites you will see the paler, and what are the conditions where you see the paler. Then icterus, again same questions similar to the paler. Then you have cyanosis. Cyanosis is very, very important. You have to know what is true cyanosis, what is pseudo cyanosis, what is central cyanosis, what is peripheral cyanosis. Okay, and there is something called as hyperoxia test. This might you might also get this in theory 2 mark. Hyperoxia test is used to differentiate between cardiac and pulmonary cause of cyanosis. So you have to know what that is. So if you are having a CVS case, you can definitely expect hyperoxia test. And cyanosis, again I told you to central cyanosis and peripheral cyanosis. And like you have to have the answers in the tip of the fingers. Like if they are asking cyanotic heart disease, please don't make a blunder by telling name of, like don't tell ASD, don't tell VSD. You have to know cyanotic heart diseases are the one that starts with T, right? This is tricuspid atresia, tetralogy of Fallot, transposition of great vessel, total anomalous pulmonary venous circulation. This should be your immediate answers. Don't make blunders in this kind of simple question where they expect you to make the blunder. So if you are crossing this stage in the case sheet properly, then the question that you might get in the systemic examination would be minimal, and it would be again easy for you. Okay, so this is about the paler icterus. So now I talked about cyanosis and clubbing. Clubbing, you have to definitely know the grades of clubbing, very important. Again, definition of clubbing is important. So my question was, what is hypertrophic osteoarthropathy? It is a type of grade 4 clubbing, and you can see that in bronchogenic carcinoma. And my question was, where would you find hypertrophic osteoarthropathy? The answer is, you have to find that in wrist. Okay, so these are the things that you have to know in clubbing. Coming to lymphadenopathy, you know, in surgery, you know, cervical, whether there is any cervical lymphadenopathy, pre-auricular, post-auricular, what are the sites you have to check, you definitely have to know. Then coming to edema, you have to know what is pitting edema, what is non-pitting edema, edema definition, what is the pathophysiology behind edema, what are the conditions you see edema. So these are the basic thing, and you have to know little 2 points about how will you treat the edema. So this is the brief thing about Piccle. So I've completed about vitals and Piccle. Now I'll talk about each system separately, so that we'll get idea about what are the minimum, what are the basic things that you have to know in each cases. First thing, I'll start with CNS case. Okay, so a prototype case would be stroke causing hemiplegia with or without 7th cranial nerve palsy. Before going to that, I'll tell you, don't panic about CNS case. Okay, some say that please take a CNS case, some say that avoid CNS case. Whatever it is, be true to your heart, but don't be scared, because the questions are going to be very basic only. So I'll tell you what are the questions that you have to cover, so that you don't have to panic about CNS case. First of all, you have to know what is the definition of stroke. Okay, so stroke has a definition, textbook definition, you have to know that. Then you have to know what are the types of stroke. So types of stroke, don't get confused in that. There are only 2 types of stroke. One is ischemic stroke, that is without blood supply, there is going to be a stroke, and due to blood loss, hemorrhage, there is going to be a stroke, that is hemorrhagic stroke. In ischemic stroke only, you are going to have thrombotic and embolic stroke. Okay, so be strong in this basics, so that don't complicate it. Don't say hemorrhagic stroke, don't say thrombotic, embolic, don't confuse it. Just go in a proper way. That is, there is only 2 types of stroke. One is ischemic and hemorrhagic. In ischemic, you are going to have thrombotic and embolic. Then you have to know, next important thing that you have to know in a CNS case sheet is that you have to know the blood supply of internal capsule. This is another very important thing that you have to know. I'm going to attach the case sheet in the link below, so you have to know what is the order that you have to go for the CNS case sheet, and I will just see that, and I'll tell you a little about the order that you have to know. So in examination, first you have to know the higher mental function. So higher mental function is what the conscious, orientation. If the patient is well versed in answering everything, you can write the patient is conscious, well oriented, time, place and person. But if the patient is not conscious, don't repeat as if you're doing for abdomen or respiratory case. Don't write blindly that the patient is conscious, well oriented, time, place and person. Properly examine the patient. Then you have to ask about the memory of the patient also. Then you have to check memory. So there are 3 types of memory, right? Immediate memory, recent memory and remote memory. So based on that, you have to write regarding the memory also. So first you have covering higher mental function, then you have cranial nerves, then in motor system you have bulk, power, coordination, gait and involuntary movements. Then you have so after completing the motor system, you have to check the reflexes, that is superficial reflexes are there, deep reflexes are there. Then you have to go check the sensory system. Then you have the signs of meningeal irritation. So this is how you are going to go about with the systemic examination of the central nervous system. So cranial nerves, please watch a video on YouTube. So there are actually several videos out there on YouTube. So please watch that video for cranial nerves examination. You have to know each and every nerves examination. Especially more important nerves is 7th nerve, because as a UG student we might get a stroke, hemiplegia case with or without 7th nerve palsy. So you have to know what are the signs of 7th nerve palsy. And in 7th nerve palsy there is UMN type of 7th nerve palsy and LMN type of 7th nerve palsy. Best thing is remember this, in UMN type of facial palsy, upper part of the face is spared. Please note this point, because this is very important. Okay. Then you have to know about 10th vagus nerve, gag reflex, what are the components of gag reflex, everything you have to know. Then overall cranial nerves, you have to know the order in which you are going to examine. Please write right, left. Okay, you are going to check for both sides, right? That is very important. So know how to examine each cranial nerve. Then coming to the motor system, you have to measure. So first thing is bulk. So there are 2 types of palsy, right? UMN palsy and LMN palsy. You have to know the differences. you have to know what is UMN type of lesion and LMN type of lesion. In UMN, the motors are coming from the like corticospinal tract or corticobulbar tract. So these are the descending tracts that are coming from the brain to the rest of the body, right? So you have to know the UMN are mostly pyramidal and extrapyramidal tracts, whereas LMN lesion would be involving the spinal cord or the cranial nerve nuclei. So this basic thing you have to know what is UMN and what is LMN. Okay, next thing is in UMN the power would be basically it can be normal, whereas in LMN the power will be lost, the tone will be decreased, whereas in UMN the tone will be increased, and the wasting of muscles will be present in LMN. A typical example would be a case of polio. If you are seeing normally the patient, if there is right-sided involvement, there will be severe wasting of muscle. The muscle will be so atrophy. Whereas in a stroke patient, it would be acute condition, right? There won't be any visible wasting of the muscle. So that you have to know. So please be thorough in what is UMN, how will you differentiate UMN from LMN. This is one of the important question in stroke. I was talking about motor system bulk. So bulk you have to know, you have to measure each side, upper limb, lower limb. You have to compare right side, left side. You have to know the gradings of power. Okay, power, that is power grading. So my Viva question was, how will you grade power? Okay, next I'll talk in reflexes. There was another question like what are the types of reflex. Okay, grades of reflex that you have to know. Then you have to know what is normal power again. So 5 by 5 would be normal power, like healthy people power would be 5. So that also you have to know. So regarding bulk, whether there is any wasting or no wasting, in UMN type mostly you won't have any wasting, and power also you know that you have to know the grades and you have to grade the power accordingly. In UMN also the power might be decreased. Okay, it's not like whatever you are finding in the case, please write it, and you have to have the knowledge to explain that this was the power found in the patient so and so. Okay, then you have to write about the coordination, gait and involuntary movements. In case of gait, in a stroke patient that would be a circumduction gait, so mention that. And if the next question is what are the different types of gait, you know, you can tell about Parkinsonism, Festinen gait, and you can talk about ataxic gait, so in cerebellar lesions. So you have to know different types of gait and whether there is any involuntary movements okay, so these are the things that you have to talk in the motor system. Then coming to the reflexes. Reflexes are again very important. There is superficial reflexes and deep reflexes. Some superficial reflexes are conjunctival, corneal, abdominal reflex. Then you have cremasteric reflex. These are the superficial reflexes. You have to know the root value for this. And in case of deep reflexes, what are the reflexes? Biceps reflex, then you have triceps reflex, you have knee jerk, then you have ankle jerk, right? So you have to know again the root values of each of this, because they're definitely going to ask you the root value. And please know how to hold a knee hammer and how to examine the knee jerk, everything. It is very easy if you have practiced already. Even if you have not practiced even one time, please go to YouTube and watch a video and know the root values and how to perform. No 3 jerks like properly, because if the examiner is asking to randomly perform any like deep reflexes that you can perform, so if you are thorough in at least 2, you will be able to elicit the response. Okay, so that is one thing. And in reflex you also definitely have to know about plantar reflex. Okay, in case of UMN type, it would be extensor plantar response. Okay, that is called as Babinski. So you have to know what is a normal. Normal would be a flexor response, whereas in a stroke UMN type, that would be extensor type of reflex, that is called as Babinski sign. Okay, now coming to sensory. Again, sensory you have to know whether there is any loss of temperature, vibration, proprioception, everything you have to check in the patient. If the sensory system is not intact, you have to write regarding the impressions of the sensory system. And coming to the meningeal irritation, if the patient has meningitis, there would be signs of meningeal irritation, right? Like neck pain, fever, then you have Brudzinski sign, Kernig sign. You can also check that in the patient, and you can write there is no signs of meningeal irritation. So this is how you are going to go about the stroke. And when you are writing the history of presenting illness, then when you are writing it, please write it very, very, very clearly, like a story. Like the in case of a thrombotic or embolic stroke, mostly thrombotic stroke would happen when the patient is in rest, like when he is sleeping, whereas embolic stroke would happen when the patient is active, performing any exercises or stuff. So you have to know why thrombotic stroke occurs in sleep, why embolic stroke occurs during exercise. And again, major cause of embolic stroke or CVS cause would be atrial fibrillation. That's why when you're writing the pulse, we are going to rule out everything. So if it's a regular pulse, you are basically ruling out atrial fibrillation, right? So because in atrial fibrillation there would be a irregular rhythm. So these are the key factors that the examiner might also ask you, what is the thing that you look for vitals, especially in a stroke case. You have to say that you have to rule out atrial fibrillation because atrial fibrillation is a major cause of stroke. Okay, so we are writing that. Then you have to write regarding proximal or the distal muscle weakness. Proximal muscle weakness would present as if you can't like raise your hands above the head. Okay, so that is proximal muscle weakness. Whereas distal muscle weakness would be holding a phone, difficulty in cooking, everything. Whereas in lower limb, again, proximal muscle weakness would cause difficulty in squatting or raising up from a sitting position, whereas in distal muscles would be gripping the slipper. So these are the points that they expect you to answer in everything. So I've told you about bulk gradings, and again in reflex you have to definitely know about the gradings of reflex. It's very, very important. This were the 2 Viva questions for me in the systemic examination. Okay. So what else in stroke? We have covered UMN versus LMN. You have to know definition of stroke, and then you have to know what are the stroke syndromes. There are some syndromes called as CADASIL, CADASIL. You have to know the full form of CADASIL. Then you have to know what is stroke, how will you define stroke in young patients. So less than 40 years, if the people are getting stroke, it is called a stroke in young. And then again you have to know 2-3 causes for what are the causes of stroke in young people. And again, my advice would be don't panic if you get a CNS case. If you're writing the case sheet properly, if you're explaining each and every aspect properly, if you're knowing the grades of everything, if you are knowing the basics, you will be definitely treated well, and they will provide you very, very good marks. So don't worry about it. Now, other thing that you have to know is localization of stroke. Okay, they are going to ask how are you telling that this is an internal capsule. So you have to know what are the different levels of lesion. One is cortex, then you have subcortex. It can be internal capsule stroke. It can be a brainstem lesion or a high spinal cord lesion. Okay, so you have to know what and all. For example, in cortex there will be involvement of frontal lobe, parietal, temporal. So you have to write features of that, like agraphia, acalculia, abulia. Then there will be aphasia. So all the A would be cortex lesion. Our patient, again, if there is internal capsule involvement, there is only going to be one-sided weakness. Okay, one side of the body would go for paralysis or paresis. So you have to know again what is hemiplegia, what is paraplegia, what is quadriplegia. So the plegia means you complete loss of movements, whereas paresis means weakness. So you have to know these things also. So I've talked about levels of lesion. Again, if there is a brainstem, you have to know whether there is midbrain or pons or medulla, cranial nerve involvement, everything you are going to cover in the CNS examination. Now I'll tell you how to write a diagnosis. Okay, so the diagnosis again going to be I'll see and tell you a case of left-sided hemiparesis with left-sided UMN facial nerve palsy involving the lenticulate branch of middle cerebral artery with lesion at the internal capsule. Then you're going to write about the etiology, probably due to thromboembolism. So it's like clinical feature, anatomy, pathology and etiology. So this is how you're going to give the final diagnosis. Even in a case of long case or you're getting a CNS short case, please write your diagnosis at like this what I said. And this diagnosis is also going to be in the case pro forma that I'm going to share. So please by heart the diagnosis format. You can just fill it according to the patient. So diagnosis format is very important, because if you're presenting a long case and the like you are the last roll number and the examiner wants to hurry, means they are going to ask you only the diagnosis. So if you're presenting properly with each and everything without missing out any content, then the examiner is going to be happy and not going to ask you any further questions. Okay, so this is how we are going to present the CNS case. Again, so one thing is you are going to write this diagnosis, right? Then you have to, in summary, before writing the diagnosis, you can write a summary where you are telling about all the positive findings, and you can also rule out everything. You can tell that there is no sensory involvement. You can tell that there is no cerebellum involvement. There is no cranial nerve involvement. So after telling these, you are ruling out, then you can tell the diagnosis pakka with the clinical feature, anatomy, pathology and etiology. So the CNS is complete. Now let us go to abdomen case. Okay, so abdomen is what I got. for both model exam and as a long case, and for the university also I got abdomen case. So abdomen case, the main thing that you have to know about is liver cirrhosis. Please be thorough with the theory part. Okay, in case of CNS there is going to be a lot of examination and question regarding that, so the actual questions would be very less in CNS, whereas in abdomen, since the case sheet was also going to be very less, questions that are going to come to you, it's going to be very maximum. So if you are ready for a abdomen case, you have to be pakka in the theory part. Okay, so now I'll tell you what are the things that you have to know in liver cirrhosis. So first, know what is alcoholic liver disease, what is non-alcoholic liver disease, and in liver disease you have to know what are the stages of the liver disease. Okay, how it progresses to liver cirrhosis you have to know. Then please don't make a blunder by saying the liver is enlarged in liver cirrhosis. In final stage of liver cirrhosis, liver won't be palpable at all. Okay, liver will be very shrunken. So please don't tell that there is hepatomegaly in case of liver cirrhosis. So these are the blunders that people make. Then coming to the complaints. So my question again was, what are the 5 F's in abdomen? So one is fat, again is fluid, then there is fetus, feces and flatus. So this was one of the question that I got. Then you have to know about this 5 things. You have to know about liver cirrhosis, what is portal hypertension, what is the normal portal venous pressure, beyond which pressure it will start to bleed. Then you have to know what are the sites of portocaval anastomosis. Okay, so coming to the examination part, it is like general part we have covered. In systemic examination inspection, you can just go through the Pro Forma. Right, in palpation and percussion, you have to know how will you measure the liver. So you have to know what is liver span, how you will measure spleen. So again, that was my question, how you will percuss the liver, how will you find out the liver span, beyond which you will tell it is whether there is hepatomegaly. In case of spleen, how will you, like the method, so the difference method are classing method, hooking method, whereas in a patient with ascites you have to do a method called as tipping method. And in case of spleen, what are the named methods would be Castell's method. So you have to know what are the different methods of palpating liver and spleen. So regarding ascites, so in palpation you definitely have to know about palpation of free fluid in the abdomen, that is ascites. Okay, so you have to know what is shifting dullness, what is fluid thrill, then you have to know what is puddle sign. Okay, so another thing that you have to know is shifting dullness and fluid thrill will not be seen in the same patient, because there are 2 types of ascites. Okay, one is massive ascites and tense ascites. Massive ascites is when there is 1.2 around 1.2 liters of fluid, then the patient might have shifting dullness, whereas in a tense ascites where there is around 2 liters of fluid, there won't be any shifting dullness because the entire abdomen is filled with fluid, so you can elicit fluid thrill. So that is a thing that you have to know, that fluid thrill and shifting dullness will not be present in the same patient. And puddle sign is when there is only minimal amount of fluid present in the patient and you're not able to appreciate the fluid either by fluid thrill or shifting dullness, then you have to go through this method called as puddle sign, where the patient will be in knee chest position. It is used to elicit minimal amount of fluid present in the abdomen, up to like 250 ml also it can detect, puddle sign can detect. And coming to percussion, again is trop space, what happens when there is obliteration of trop space. And about tidal percussion I'll tell you in a respiratory system. So you have to know regarding the trop space and what are the boundaries of trop space and what happens if there is any obliteration of trop space. And in inspection also you're going to check whether there is any dilated veins, that is caput medusa, and that's why I told you to also read about portocaval anastomosis. So these are the sites where the bleeding will occur when there is portal hypertension. And you can also, as a UG student, we won't be doing a parectal examination, so we don't have to mention about it. And what is the significance of CNS in abdomen case? This is very important. You have to definitely know about hepatic encephalopathy. Again, my next question was, how will you call the liver cirrhosis as compensated or decompensated? If there is a decompensated liver cirrhosis, then there would be ascites, there would be hepatorenal syndrome, there would be hepatopulmonary syndrome, and the important thing is hepatic encephalopathy. Okay, so what is hepatic encephalopathy? You have to know the grades of hepatic encephalopathy, and the patient overall would be so confused, so not oriented. So when you are writing a CNS examination, before itself in general examination, you have to give the idea that the patient is not cooperative or not oriented to time, place and person, things like that. And there are grades of hepatic encephalopathy. Then they will ask you what is the treatment of hepatic encephalopathy. The basic prophylaxis and treatment would be a lactulose syrup. Okay, and there are other medications like rifaximin. You have to give drugs like that. to prevent hepatic encephalopathy and also for the treatment of hepatic encephalopathy. Now and also I left about head to toe examination. Before starting the systemic examination, you have to write a proper head to toe examination, because head to toe examination is very important in liver cirrhosis. Starting from hair, the patient might have alopecia. In eyes, the patient might have conjunctival hemorrhage. In mouth, there will be any lesions. In case of chest, there would be any telangiectasia or spider nevi. In case of hand, you might have a dupuytren's contracture or a palmar erythema. And in testicular atrophy can be there due to excess estrogen. And you can also write about edema in the patient. So head to toe examination is very, very, very essential in liver cirrhosis. You might get, I got a question like what are the things that you will find in head to toe examination. So please learn head to toe examination. Another thing I left is in inspection you have to know about the umbilicus, everted or inverted. So you have in case of ascites, the umbilicus would be everted. So you have to mention about that also. And I've told about distended veins and everything. So you have to know the complications of cirrhosis. What is a compensated liver cirrhosis? What is decompensated liver cirrhosis? Now your diagnosis would be a case of liver cirrhosis with portal hypertension due to what is etiology alcohol, and with or without complications of liver cirrhosis. If there is any hepatic encephalopathy, you have to write with hepatic encephalopathy. If there is no hepatic encephalopathy, you can also add a point with no symptoms of hepatic encephalopathy. Or generally you can write no complications of liver cirrhosis. So this is how we are going to complete the abdomen case. So coming to the respiratory system, my prototype case would be COPD. Okay, so chronic obstructive pulmonary disease. So now we have to know the cardinal symptoms would be cough, chest pain, breathlessness, sputum, hemoptysis and wheeze. Now we have to know what is the difference between hematemesis and what is hemoptysis. So that is one question. And you have to know what are the components of COPD. If they are taking COPD has emphysema and chronic bronchitis. Okay, these are the two things. What happens is people get confused between bronchiectasis and chronic bronchitis. So you have to definitely know that emphysema and chronic bronchitis are the components of COPD. Right, so you have to know regarding that. And you have to know about markers, external markers of TB. Then you have markers of HIV. You have to know about this. So now you also have to know what is the demarcation of upper and the lower respiratory tract. So upper and lower respiratory tract demarcation externally would be cricoid cartilage, whereas internally it would be glottis. So you have to know that point. Then coming to the complaints, you have told you hemoptysis, hematemesis, cough, and in case of bronchiectasis, the sputum would be so copious amount of sputum would be there. So you have to know regarding that. Extra points that you have to know is regarding in inspection. You have to know the chest shape, size, symmetry, everything. In palpation, you have to know palpation and percussion. You have to know about vocal fremitus, what is tactile fremitus, vocal resonance, everything. And in percussion, very important is the note that you're getting, woody note or dull note, stony dull. So these are the types of percussion. Every condition like fibrosis, collapse, pleural effusion, every condition you will get a different type of percussion note. So you have to know that. So regarding type of breathing, the normal would be normal vesicular breathing, and you have in the normal vesicular breathing, the inspiration phase would be greater than the expiration phase. So that you have to know what is vesicular breathing, and different types would be tubular breathing or a bronchovesicular type of breathing. In a bronchovesicular type of breathing, the expiration phase would be more than the inspiration phase. Okay, so that is the typical of COPD. So you have to, in a COPD case, you have to mention regarding that. And also I missed out certain points, but you can definitely go through the Pro Forma and get an idea of that. You have to measure the transverse diameters, the anteroposterior diameter. In a COPD patient, you might have a barrel chest where the anteroposterior and the transverse diameter ratio would be 1:1. So if you are measuring only, you will get the idea of the barrel chest. So you have to mention regarding this. Another important thing in inspection and palpation is position of trachea. Inspection also you can find the position of trachea, whether it's central or shifted to right side or it's shifted to left side. And in palpation you can find trail sign, and again you have to confirm the findings of inspection in trail sign. And you have to know the mediastinal shift. Okay, if the mediastinal shift is to the same side, it can be a fibrosis or collapse, or the other, if the mediastinal shift is to the opposite side, then it can be a pleural effusion, or it can be a pneumothorax. Okay, so things like that. And in case of vocal resonance, vocal fremitus, everything, the vocal resonance would be increased. When would it be increased? In case of a consolidation, it would be increased, whereas in case of a pleural effusion, that it would be decreased. So the basic points, everything you have to know, especially this mediation shift, vocal resonance, what are the conditions where it is increased, where it is decreased. You definitely have to know this. Please don't confuse and make a blunder in the examination. So now I'll tell you how to write the diagnosis of a RS system. Okay, so if it's a COPD case, okay, a case of chronic obstructive pulmonary disease due to smoking, you're writing the etiology. And now we are going to write with or without features of right heart failure, that is cor pulmonale. Now my question next, when I presented this diagnosis, my question was what are the signs of right heart failure. Now you have to tell what are the signs of right heart failure. Elevated GVP, then you can have ascites, then you have peripheral edema. Then important thing that my professor especially likes was is the parasternal heave. When would you get a parasternal heave? Is when there is a pulmonary stenosis or a pulmonary hypertension, right? So then my question was what is a murmur finding that you would find. So I answered that the P2 component of the S2. So S2 heart sound has two components, A2 and P2. So in case of a pulmonary stenosis or a pulmonary hypertension, the P2 component of the S2 would be high. So this was loud. So this was another question that I was answering. So this is regarding RS. So coming to next is CVS. So again, like CNS, some are scared about CVS also. So please don't be scared about CVS. Now again in CVS you have to be well versed with theory. You have to know all the valvular heart diseases, mitral stenosis, aortic stenosis, aortic regurgitation, mitral regurgitation, tricuspid stenosis, tricuspid regurgitation. See, it's not like you have to be well versed in everything. Please know little about everything. So my university prototype case would be mitral stenosis. So what I did is going through mitral stenosis properly. What are the murmurs in mitral stenosis? My university expects us to know everything about mitral stenosis. Okay. So again, like every other case, we have to properly know what are the valvular heart disease, what are the congenital heart diseases, what are cyanotic heart diseases, what are non-cyanotic heart diseases. So coming to systemic examination of CVS. So first thing is inspection. Please go to the Pro Forma. Everything is already available with that. So extra points only I'm going to tell you, like major things that you have to concentrate is in inspection. If there is a precordial bulge, what are the conditions you will see the precordial bulge. Again, important thing in CVS is knowing about the apical impulse. So please know about the definition of the apical impulse. So that is very, very important. Then you have to know that the apical impulse will be confined. The location of the apical impulse is next important. Okay, you have to know proper definition of the apical impulse. Then you have to know the site. The normal site is left fifth intercostal space, 1 to 2 centimeter medial to the mid clavicular line. Mostly it is normally confined to one intercostal space, and there are different conditions where the apical impulse would be beyond one intercostal space. You also have to know about the duration. It would be less than 50% of systole. So apical impulse, be well versed in apical impulse. So for example, there would be in mitral stenosis, there would be a tapic apical impulse. Okay, whereas in constrictive pericarditis there would be absent apical impulse. So you have to be well versed in apical impulse. And JVP also you have to write whether the so again you have to know proper measurement of JVP, the positive waves of JVP, the negative waves of JVP, and the conditions where it is elevated. Okay, so right heart failure, again it's going to be elevated, please know that. And you can also, if time permits, you can read about different waves and what are the different conditions where you would say different waves. Okay, regarding apical impulse, please know regarding heaving apical impulse and hyperdynamic. Okay, so hyperdynamic denotes a fluid. So when there is a volume overload, there would be a hyperdynamic pulse. So when there will be a volume overload is when there is a regurgitation. So mitral regurgitation or aortic regurgitation, you would get a hyperdynamic, whereas a heaving apical impulse would be seen in a stenotic condition like stenosis.
Now
so
connected to desktop 923HC.
Okay, my Alexa is talking now. Okay, case of pressure overload like a mitral stenosis or tricuspid stenosis, aortic stenosis, you would get a heaving apical impulse. So please know what are the different types of apical impulse. So inspection, palpation, epigastric pulsations, then you have to know about thrills, everything you have to know. Coming to the percussion. Percussion in a CVS case, you can percuss the heart borders, and auscultation is very, very, very important. Okay, so you have to know what are the normal areas that you would auscultate for. Okay, so there are four: pulmonary area, mitral area, tricuspid area, aortic area. So know which intercostal space each of this area corresponds to. And if there is a mitral stenosis, you are going to check in the mitral area. So be confident. If there is a tricuspid regurgitation, you will palpate, you will auscultate in the tricuspid area. So be confident in answering that. Like a UG student, they like don't expect you to answer like well versed, but you have to know what are the systolic murmurs, what are the diastolic murmurs. You have to definitely know, especially if you are taking 2 prototype case. Be thorough with all the findings in that case, so that you can be confident in at least that case. If you are getting that case, you will be more lucky. Then you also have to know the position of the patient when you're auscultating. For example, if you're auscultating the mitral area, the best preferred position would be left lateral decubitus position. For example, when you're auscultating the tricuspid area, the patient should be in supine position. Whereas if you're auscultating aortic area, the patient should be sitting. Or then you have to know why S1, S2, S3, S4 is caused. Normally S1 is caused due to closure of the atrioventricular valve, that is closure of mitral valve and tricuspid valve. Whereas S2 is due to closure of the aortic valve and the pulmonary valve. S3 and S4 are abnormal things. So S3 gallop, you have to know what is S3 gallop, what are the conditions where you will hear S3, what are the conditions where you will hear S4. So you have to know about the heart sounds and various conditions it's seen. So there are 2 types of heart sound, low frequency heart sound and high frequency. So low frequency heart sound would be heard best with the bell of the stethoscope, whereas high frequency heart sound would be heard best with the diaphragm of the stethoscope. So you have to know this. So you also have to know about how to differentiate systolic and diastolic murmur. So systolic murmur will coincide with your pulse. So this is another point that you have to remember. Overall, be confident with a CVS case. Be thorough with apart from the valvular heart disease, be also strong with rheumatic heart disease. So know about various infective endocarditis. So know about Duke's criteria. For a rheumatic heart disease, know about Jones criteria. What are the treatment, what are the prophylaxis for each and everything. Please be thorough with that. Different types of, like I told you, what are the systolic murmurs, diastolic murmurs, different valvular heart conditions. Please know that. So this is some basics that you have to definitely know before entering the exam hall. I've given a short introduction about every system, so please don't omit any system. Try to cover every system. Coming to the spotters, the Spaler, Xrays, everything was actually a separate spotter for me. Osce, we had some certain resources provided by our university, so we went through that for Osce. In case of instruments, the basic instruments that you have to know is Ryle's tube, it is also called as nasogastric tube. Then you have to know about Foley's catheter. Again, in nasogastric tube, you have to know how you'll measure. If you're placing for a child, you have to know how you'll measure the nasogastric tube. Then you have to know about bone marrow aspiration needle, liver biopsy needle. Be thorough with these 4 instruments. Drugs, if you're going to be well versed in theory, the drugs will be very easy for you. Know extra about diuretics. So you have to know which diuretics acts in proximal convoluted tubule. You have to know which diuretic acts in distal convoluted tubule. Where does the thiazide act? So you have to know. You also have to know what is loop diuretics. Why it is. What happens. What will you do if the patient has hypokalemia? You have to give a potassium sparing diuretic, right? So you have to know all this, the drugs and everything. In case of X-rays, please go through how a pleural effusion X-ray would look like, how a pneumothorax would look like. Everything you can Google is always there. So the clinical books also provide you a proper knowledge regarding that. So please go through. So if you're reading about Foley's catheter, normally everyone would know the uses. Now if they are going to ask you what is a contraindication, where you won't advise a Foley's catheter, would be a case of urethral stricture. So you can also tell regarding that. So instruments are X-rays. Please properly hold the X-ray, that be right and left written in the X-ray, so you can just properly read that and like hold the X-rays. Then you can tell whether it's anteroposterior or what is the view of the X-ray, and you can proceed with the findings. Don't immediately, you don't have to jump to the diagnosis. You can tell the findings, and if it's any corrections, so they are not going to harm you or anything, they will properly tell you. So my final advice would be concentrate on every system, give equal importance to every system. Watch this video properly. Even you can watch it in 2x speed or everything. Some things I've actually failed to cover because I don't have the energy or the time to cover each and everything. Maybe I can give one-to-one sessions. Maybe if possible I'll try to do that, but please, after watching this video, know these things, like the things that you have to cover. So after finishing that, next you can go to the next level of preparation. So that is what my advice would be. And please don't omit any system. So go through every system properly and be confident in examination. Have your examination kits properly, like CNS examination kit, everything you have to have it properly. Have inch tape, have a torch. CNS examination kit is available. Even if you don't have the last minute, you can just get cotton and you can get cotton, coffee powder. Then you can have reflex hammer, knee hammer. Then in the knee hammer backside you can elicit the plantar response. And these are the like basic things that you definitely have to have. So yesterday I posted a story and I asked whether you have any doubts regarding the final year MBBS practical examination. So I got some questions. I'm going to skip some questions because I'm like covered almost everything in the video. What books to read? Okay, like I try to show, this is the book that I used, Arshit Balur textbook. It's the best book that I've already suggested. So you can also, other books that are available I've told in a separate video, so please go through that and check the video. I don't know whether the PDF is available, so if possible please share your case sheets. Like I don't have case sheets as such, but I'll share the case Pro Forma. Can you upload the Pro Forma? Yes, I've done. Yeah, this is one good question. How to take history as well as examine the patient with the stipulated time. So one mistake that I did in my pediatrics exam is not properly writing the case sheet because I was in a hurry, because it was my first university practicals and I was like hurrying. So what I followed from the next practical exam is that the questions that I'm going to ask, what I did was I wrote it. Okay, wrote in the case sheet. So I just had to ask the question and just fill in the details. So before, just take 10 minutes of your time. Don't like see others and get panicked. Just take your answer paper, write what and all questions you're going to write. Okay, from starting from the preliminary data, chief complaints, history of presenting illness, everything, further history, then you have general examination, systemic examination. Just write what and all questions you're going to ask. Now you can just easily fill up the paper. So that is one of the trick that I use. Examination, please do the examination and write the findings. Please be hurry. Don't spend, even if the patient is wants to share too much of information, try to make that conversation short and skip to examination, because it's very important, especially if you're having a long case. Do the examinations properly. How to pass when you get a CVS case for med? That's a funny question. Like I told you, CVS, again, please be thorough with all the valvular heart diseases. And if you're knowing the case Pro Forma properly for every case, it's going to be very easy. You're just going to fill in the details and answer some questions. So again, watch this video, you'll get a really good idea. Please share the question list which you made for books to use for each last minute tips for medicine clinical exam. Please like go through all the case Pro Forma for every case sheet, go through instruments, everything, and can you share the Viva questions that they ask for your practical cases? Actually, I've shared already. So if you watch the entire video only, you'll get here and there I've shared the questions that I've got. So yeah, there are actually many questions, but I'm going to skip because I've covered the queries already in the video. So thanks for taking your time and watching this video. So if you're about to give your exams, all the very best. Please don't panic. Please be happy. Please be smiling and perform a proper case sheet. And another advice would be, don't compare yourself with others. Don't get demotivated by the negative people around you. Fill your friend circle should be very filled with positivity only. Okay, like you should have a friend who should be happy about your success and not the other way. And know to choose your friend and be surrounded with healthy non-toxic people. Okay, that will definitely help you in your life. Okay, so that's one good advice that I can give you. Please prepare with a good mind, good soul, and you'll be able to achieve whatever you think of. Okay, so all the best and thank you.